For me, a human rights-based approach to social care has just always made sense, because social care has been something that is absolutely essential for me to be able to enjoy my human rights on an equal basis to the rest of society. Without being able to get support to get up out of bed in the morning, to go to work, to spend time with my family and friends, to get an education, to go to university, all of these things, I absolutely had to have social care. So for me, it's a fundamental part of what my human rights are about. I couldn't have a private and family life if it wasn't for the social care that I get provided for me, and that I control myself through self-directed support. It's absolutely essential for that. From that point of view, I see social care as an essential infrastructure for the equality and human rights in Scotland. Without it, the people like me across Scotland would not be able to equally participate in society and lead an ordinary life. It's absolutely essential for that. I think it's really important that the workforce fully understands the impact that social care has on people's lives. It is not just about getting people up and keeping them safe from harm and ensuring that we can eat or that we can drink or that we can go to the toilet. It's about much, much more than that. It's about the fundamental human rights we have as human beings. It's about preserving our dignity. It's about preserving our equality and rights to participate in society on an equal basis to non-disabled people. And it's so important that the workforce, all through the workforce, from the providers of social care to the commissioners of social care to social workers themselves who are doing assessments, that they get the how crucial it actually is to the individual lives of the people who use it. And we see quite a lot in the media around the human rights abuses that have gone on in the past, and particularly very much on the delivery end of social care. That in itself is unacceptable and is something that does definitely need to change, and I would like to hope that there is a focus going forward on that end of things. But I also think we need to not ignore the fact that human rights based approaches need to be built into systems, strategies and structures within social care. So things around eligibility criteria, how things are funded, who's funding what are the sorts of things you can do through self-directed support with your funding. All of this requires a human rights based approach, not just the kind of front end, sharp end stuff, which of course we would expect that all social care should be delivered respecting people's human rights, their dignity, their right to a private and family life. But it's more than that. It comes at the point at which somebody decides how much resource will be put in order for an individual to be able to access social care. So we need a human rights based approach for social care from the start to the finish, not just because it's the right thing to do, not just because we're obliged to do it, but because if we don't do it, then social care will not receive the support, the public backing, and of course therefore the finances that need to go into it, that we need in order to be able to benefit from the contribution that disabled people and other social care users can make.